Emma Gierschik is a multi-award winning keynote speaker and an Australian Financial Review's 100 Women of Influence winner, and also has received an Order of Australia for her work with vulnerable children. Emma joins us today to talk about how we need to protect our vulnerable children and some of the things that we can do to help them recover from the trauma. Morning, Emma.
Good morning.
Now,
thank you for having me.
You're welcome, Emma. Such an important area that you work in, and such amazing accolades and awards that you've got for your work. How do we protect and how do we support our children in the recovery from trauma?
Well, first of all, we actually need to recognise that it's taking place, that our children have been affected by trauma, abuse, neglect, not being cared for, and experience of violence can all create trauma in our children. A lot of people don't acknowledge it, or if they do, they don't necessarily recognise the long-term impact it's having on them. And they think that, you know, the children will just get over it. We're not placing enough emphasis on healing our children. They get on with life. They may have a band-aid patch with a tiny little bit of support, but without proper ongoing support, they're just going to embody the experiences that they've had and go on and have other experiences that aren't so great because they're carrying all this baggage. So yeah, we need to be sort of getting in there, recognizing when a child is experiencing mental health problems, challenges, changes to their behavior, and actually sitting down and helping them to try and fix, you know, what's going on for them. And depending on the age of the child, the vulnerability of the child, the ability or disability of the child, they may or may not be able to identify or recognize why they've got these strange feelings, why they are feeling sad all the time, why they are feeling frightened all the time, why they're having a somatic response, a full body response, without realizing what's taken place. Because our body does remember what we experience, and it's the same for children. The body keeps score. And, you know, triggers can be things like, there can be innocuous items that somebody's past. It could be a word, it could be a smell, it could be a time of day or a time of week. And these can all create a trigger response in a child where their body remembers they weren't safe at that particular time, or they had a negative experience. So their body will have a reaction, and they don't necessarily mentally and cognitively know what the connection is. All they know is suddenly they're really scared, or they're very emotional, or they're feeling very unsafe. And that's quite often when children will maybe lash out, or they'll act inappropriately, and people class it as poor behavior and bad behavior. And usually, if you look behind it, is there some anxiety or there's some experience that's triggered that? And that's where I think as a society we need to actually stop reacting and start being proactive and start actually looking at the bigger picture. And instead of responding to a child that's necessarily done something that's not ideal behaviorally, not jump into conclusions, actually trying to work out what's going on and provide the support for them.
Now, we know that this trauma needs ongoing support and consideration, because early childhood trauma can have the ability to literally rewire the brain and force them into what I call the downstairs part of the brain, where everything responds through the limbic system, and they're hypervigilant to threats, and this is where the anxiety comes in. Is that right, Emma?
Absolutely, absolutely. One thing that people don't realise is that the trauma can actually start in utero. So when somebody's pregnant, if they're having adverse experiences, that will transfer across to the baby while they're in utero, and it will, exactly what you're saying, affect the chemical makeup in the brain. Babies that have experienced a trauma during a pregnancy are often born earlier, and they may have a smaller birth weight, a lower birth weight, and they can also have more health conditions, health problems to deal with. And a lot of people don't necessarily connect that a child that's experienced trauma from birth or from in utero, it is going to have that effect. I certainly had an experience with a lawyer saying that a baby wouldn't be affected or a toddler wouldn't be affected by exposure to trauma, which is absolute nonsense, and quite an ignorant response. And this is actually quite frightening when it's people within a judicial system that have got this belief and this understanding, because people with judicial powers are ones that make decisions about children. And if they're not taking into account this sort of stuff, they're not actually doing justice to the child. So they're doing a disservice. So there's a huge responsibility to be aware of the effects of trauma on children, and that it doesn't, they don't just brush it off. They actually need support and they need help unpacking things that they've experienced.
Yeah, I recently read a study that cited that mothers who are experiencing stress and trauma during the pregnancy, that the brain function of their child at 3 and 6 months was actually lower than a woman who wouldn't do it. So the in utero thing is definitely a thing. How do we as a society and an organisation with the systems in place protect and provide the safety that's needed for our children to start on a level playing field, that aren't subjected to this, just to have a normal beginning?
Well, first of all, it's about creating awareness, and it's about generating awareness. I personally had a pregnancy. I was in a family violent relationship. My daughter was exposed to violence all through the pregnancy. I thought I was protecting her as a protective mom. I had got absolutely no idea, and none of the midwives or the hospital staff told me the effect of what we were being exposed to was having an impact on her. And I think it's because there wasn't necessarily that knowledge and that information actually out in the field for people to feel comfortable to say that. So one is education, educating the medical staff, educating the family, the women who are pregnant, the maternal health nurses, and then, of course, providing protection for vulnerable women. And it's not just about family violence. It can be a whole range of different traumatic events that can affect somebody. It will pass down in utero. It will pass down to the chemical brain, the makeup in the brain, and the child's natural responses. Children can be born startled. They can have these reactions that they've experienced in utero. They can actually have them when they're born and they're alive as a result.
Yeah, we know that cortisol and some of the adrenalines and things like that actually change the structure of the brain of children in utero, so they start behind. We also see the impact of what's known as intergenerational disadvantage, where we see that continuation of the pattern in our First Nations people and children's that continues on. We see it in some of the Holocaust survivors where their children's brain structure has actually changed. And I love the fact that you speak from personal lived experience as well, Emma. So you're not just a boffin or a academic, you've actually lived it. What can we do? What would you like to see happen?
I'd like to see greater recovery support being made available for children. As you say, I've lived traumatic experiences, and so has my daughter. But prior to that, I've actually got a case management background. So I've done a lot of work over many years working with children in out-of-home care placements. Now, a child that's in an out-of-home care placement will be traumatized by being in out-of-home care. There aren't the supports available for them. There isn't that sense of responsibility for them, that sense of belonging. The reason that they have been separated from their parents is usually due to a traumatic or a series of traumatic events. They're left unaddressed. Then they experience the trauma of being separated from their primary caregivers to go into into an out-of-home care situation. It's from a safety perspective, but it's still going to have an effect on the trauma for them, that they're separated from this primary caregiver. Then they'll experience trauma being in the out-of-home care system just by the exposure to so many different children that are also dealing with their own trauma, and staff that don't necessarily understand the impact of what they're going through. We're not at the moment providing as a society sufficient trauma recovery support for children. We're not identifying that children have got these needs, and we need to be including trauma-informed practices in every aspect of our day-to-day life that involve children. So schools need to be doing more around, and I'm not criticizing, I don't mean to sound like I'm being critical, I'm just talking ideal world, what we'd like. We need schools to be looking at more trauma-informed practices. You know, if a child is, you know, disruptive in the class, it's not necessarily about kicking them out of the class or excluding them or sending them home. You know, it's about finding out why are they disruptive in the class. You know, what is going on that they're feeling so anxious that they actually can't concentrate. And if they can't concentrate and they're having to sit in a room, they're going to be disruptive. And that's just a really, really minor one. You don't know what happened the night before. You know, when you were at home, you don't know what happened that morning. We need to be considering what supports the children need. We need to be providing opportunities for them to get counselling, or in the cases where children are too young to understand counselling, looking at other alternatives. And play therapy is an amazing support for children. My daughter's had play therapy for about 3 years now. And to be perfectly honest, I didn't respect it at the start. I just thought, you're just playing with the child. You know, what difference is that going to make? But as the relationship developed, we could actually see that she would act out things that had taken place during her week at school that had triggered previous traumas. And it was absolutely fascinating to watch this. And sort of halfway through a session, she would suddenly become really angry, and she'd start slamming cupboard doors, or she'd start throwing things on the floor, or making noises, and just acting really inappropriate, knocking chairs over, clearly looking for a reaction. And then when she'd sort of gone through all of this and we'd sort of worked with her, then she would relax and calm down, and then she'd sleep in the car coming home, because she's clearly used an awful lot of energy to process something that's happened, that has affected her, that has connected with the previous experience that she's had. She didn't necessarily have the verbal skills when she first started, so she couldn't articulate what was going on. She might have said something that was like totally irrelevant to what was actually going on for her, but that was her way of identifying that she didn't feel safe in some capacity. So play therapy has got a really unique role to play for children. You know, and play therapy doesn't have to be about your toddlers. Play therapy can be for, you know, right up to teenagers, as long as it's age appropriate for where they're at. Because one thing that can happen with a child that's traumatized is they can stick at that particular age that they've experienced the trauma. So you might have got a 15-year-old that's displaying risk-taking behavior, but when you actually start doing some counselling, or you start doing some role play, or you start doing some play therapy, or unpacking something, they can actually revert back to an experience that happened when they were 5, and they need to be nurtured and spoken to and treated as the 5-year-old, because, as I said, they may not have even connect the dots, they might not know what it's about, but that's about getting back to the root cause of it. So there's actually a lot we can do. There are some programs in existence. I tried to do some research in terms of what was available around Australia, and quite a few organisations said that, you know, that they offer trauma-informed support for children. I think it's a little bit hit and miss, in all honesty. And the support for children with a disability is a really specialised area, because it's not necessarily about just having skills of counselling skills or play therapy skills. It's about understanding some of the nuances connected with a child's additional needs, being non-verbal, ruminating about particular problems, not, you know, having particular idiosyncrasies and behaviours. So it's kind of, to do work with a child that's got additional needs, you kind of need to have a different level of training to be able to, you can't just go in and sort of like, you know, I'm a play therapist or I'm a counsellor, I can work with any child. You've kind of got to sort of meet the child where they're at, and you've got to sort of honour the process of the child.
All right, Emma, what a pleasure to talk, and thank you for the work you do. It was great to have you on The Informer.
Thank you. Thanks for having me.